Order. All right. Right, let us begin. We've got to start with the clerk now, who will proceed to read the orders of the day. Statements first, sorry.
Statement, Pat McFadden.
Right, let me start again. Let's start off the day with a statement from Pat McFadden, the Secretary of State.
Thank you, Mr. Speaker. Yesterday, Baroness Hallett published her report from the first module of the UK Covid-19 inquiry, which examines the resilience and preparedness of the United Kingdom between 2009 and early 2020. My thoughts, and I'm sure the thoughts of the whole House, are with the families of those who lost loved ones during the pandemic. Their grief and the nature of their loss is harrowing. So many loved ones lost before their time. So many heartbreaking last goodbyes said over a phone or an iPad, or in some cases, not even the chance to say goodbye at all. So many friends and family members denied even the chance to go to a funeral, and many others who found their lives changed by COVID forever. We can only begin to imagine the anguish and the anger that people feel. Because this report confirms what many have always believed, that the country was not as prepared as it should have been, that more could and should have been done. Baroness Hallett is unequivocal. The UK was, she says, ill-prepared for dealing with a catastrophic emergency, let alone the coronavirus pandemic. And she finds that processes, planning and policy across all four nations failed our citizens. There were fundamental failures of state, with poorly performing public services, as well as health and social inequalities contributing to our vulnerability. The inquiry finds that the UK prepared for the wrong pandemic, with a focus on influenza to the effective exclusion of other potential pathogens. There was a lack of leadership, a lack of appropriate challenge and oversight from ministers and officials, which allowed major gaps to open up in the UK's resilience in the period leading up to the pandemic. Baroness Hallett finds fatal strategic flaws underpinning the assessment of risk and a failure to learn sufficiently from past civil emergency exercises and outbreaks of disease. Ministers and officials took false comfort from a positive analysis of the UK's preparedness. Not enough thought was given to how we might seek to prevent the worst effects of a pandemic, such as with a system of test and trace, rather than accepting the consequences of spread as inevitable. In this emergency, the cracks in our society were exposed. The inequalities were glaring, and that weakened the response. And that's why the report's findings on the most vulnerable are so important. What it says about the elderly, ethnic minorities, those already subject to existing health inequalities, particularly in the early months of the pandemic. Those with higher risk of serious illness who were asked to shield for extended periods, those living in overcrowded houses, working in the gig economy or on low incomes, those who suffered as a result of the appalling increase in domestic abuse during the lockdown, and of course disruption to education and the inequalities of vastly different access to online learning and IT equipment. Resilience has to be for all of us, not just for some of us. Amen. Mr. Speaker, the underlying picture this report sets out is stark. Before the pandemic began, our public services were already stretched to their limit. During what should have been normal times, this was especially true of the NHS. Overstretched, even before the pandemic hit, key workers in other services overburdened in normal times and then asked to go above and beyond. And a nation can only be as resilient as the foundational strength of its infrastructure and public services. So as I stand here today, with 8 million people on NHS waiting lists, prisons overflowing, councils pushed to the brink, and public services in a worse position than they were even in 2020, we must ensure that we are prepared. Baroness Hallett says it's not a question of if another pandemic will strike, but when. And resilience isn't just about another pandemic, but the full range of risks that we face. And we're reminded of that this morning as reports come in of a global IT outage affecting airlines, GP surgeries, banks, media organisations and other organisations. It is not easy to know what the future holds. You can't plan fully for every possible risk, but we must do what we can to learn the lessons of this period. Government's first responsibility is to keep the public safe. That's a top priority for this government, with a long-term approach to strengthening our national resilience. I will lead a review of our national resilience against the range of risks that the UK faces. I'll chair a dedicated Cabinet Committee on Resilience to oversee that work. And of course, it's not just about central government. We will work with the devolved governments, our regional mayors and local leaders as we consider the recommendations in this report. Because when we have an emergency, we should do everything we can to work together locally and nationally. The Prime Minister has already started to reset relationships with critical partners because resilience is too important for division to get in the way. Instead, it has to be about cooperative strength. Mr. Speaker, some improvements to our operational effectiveness have already been made. The previous administration did make efforts to improve preparedness. These include changes in the way the government accesses, analyses and shares data, including with the public. They also changed the risk assessment processes and the way in which the centre of government works to prepare for and respond to crises. So as an incoming government, in office for just 2 weeks, we will look at those efforts in the coming months as we develop our own approach. Where things are good, they should be kept, and where they're not good enough, they should be changed. The inquiry's report recommends improvements to the way that whole system risks are assessed and managed across the UK government and the devolved governments, and improvements to the leadership and oversight provided by ministers. The government will carefully consider all the findings and recommendations, including considering any findings from the Grenfell inquiry that also have a bearing on resilience planning, and we will respond in full within 6 months. Mr. Speaker, we'll play our full part also in international efforts to improve global health and pandemic preparedness, from disease surveillance and vaccine development to strengthening health systems in the global south and building even greater international cooperation. The United Kingdom has a huge amount to offer, and it's in our national interest to do so, because as we have seen so powerfully, pandemics do not respect international borders, and so global health security is an essential element of national security. Mr. Speaker, I would like to thank Baroness Hallett and her team for all their work so far, and for putting the voices of the bereaved at the heart of this inquiry. Amid the tragedy of this pandemic, the British people came together in the most extraordinary ways, from the incredible service and sacrifice of our frontline workers, not least in the NHS, to the generosity of volunteers across our communities, supporting one another with acts of kindness. It was a story of service that showed the very best of our country. And this government of service is determined to learn the lessons from this inquiry and to prepare as best we can for the future, because that is the duty that we have to the people we serve, and indeed to the memory of those that we lost. And in that spirit, Mr. Speaker, I commend this statement to the House.
Shadow Minister Ed Argar.
Thank you very much, Mr. Speaker, and can I thank the Chancellor of the Duchy of Lancaster both for the early sight of his statement, for which I'm grateful, but also for the tone in which he approached this and the way that he has addressed what is an extremely sobering report on Module 1 of 9, and I suspect there will be many more such sobering reports that we will look at in the coming months. I'd like to put on record our gratitude to Lady Hallett and her team for the work that she has done, and to all the witnesses that gave evidence, but particularly to those who had experienced loss, who had experienced trauma, because in giving that evidence, while it was vitally important, will not have been in any way easy for them, given what they had been through, and I pay tribute to them for doing that. This was not only a hugely important piece of work, the first of 9, but it is the least this country owes to those who lost loved ones in the course of this pandemic. Quite rightly, the Chancellor talked about the way this country came together in the face of an unprecedented event, about which we learnt more every day it went by, and as the country had to adapt to that changing level of knowledge. But I want to join him in paying tribute not only to the emergency workers and all across this country who worked in whatever profession, in whatever way, to come together to help the country get through that, but particularly those who worked in our NHS and care services, and to all those, as I say, who lost someone. It was an incredibly traumatic time for the entire country. What we have seen set out today by the Chancellor and by Lady Hallett yesterday is deeply sobering. It lays bare failures of state in respect of planning, in respect of challenge, in respect of resourcing, and in respect of leadership, and irrespective of government or party in power, it is incumbent upon all of us to look at that in the spirit in which Lady Hallett has put forward her recommendations. I'm grateful to the Chancellor for his recognition of the work that has already been done since the pandemic to improve resilience in this country, to make sure we are better prepared for the next pandemic. We started that work in government, announcing the largest overhaul of our resilience structures in decades. We created the Resilience Directorate within the Cabinet Office, breaking it out from day-to-day crisis management so it could focus on resilience, horizon scanning and better preparedness. And we set up the Resilience Academy to increase and improve the training offered to ministers, MPs, civil servants and all those in civil society that respond to crises, and announced a new national exercising programme to test our systems. The Chancellor quite rightly highlighted that the focus of previous pandemic preparedness planning was focused around influenza, and that was seen in the context of Operation Cygnus, which was often pointed to as the way, the blueprint of how to prepare for these things. But he's right, it focused on influenza, and the challenge with influenza, of course, is we do have therapeutics. In the case of the COVID pandemic, we didn't. And so we need, as a country and as civil society, to look completely across the piece at how we can better prepare for whatever eventuality occurs. The Chancellor, in setting out his next steps, I think adopted exactly the right approach to this, and I'm grateful to him for that and for his candour. There will be still many more lessons to learn, and it's incredibly important for our country, this government, any future government of the UK, that we learn these lessons to ensure we're ready for future pandemics, however painful those lessons may be for government or for others. I'm very grateful to him for his commitment to respond swiftly. I have a few questions for him, if I may, which are to ask him what plans does he have to consult with the devolved and indeed local government structures in our country on the proposed detailed changes to how they would operate in the context of a future emergency. What steps will he and the government be taking to ensure our emergency planning structures are more cohesively joined up if our country is to face another pandemic? But more importantly, what I want to conclude by saying to the Chancellor, if I may, is that we stand ready to work constructively and openly with him and with the government in the national interest to make sure that as a country we learn the lessons from this module, from this pandemic, but also from future recommendations from Lady Hallett to build better resilience in our country and to ensure that our country, irrespective of who is in government, is better prepared in the future. I think that that is the least all of us in this House owe the country, but also the least that all of us in this House and in government of whichever party owe those who were bereaved, who lost loved ones, and who suffered in so many different ways, as he alluded to, those who suffered their mental health, those who suffered as children not being able to go to school, those who suffered from domestic abuse, and people up and down this country who suffered and in many ways still do suffer from what happened to them back then. So, as I say, I approach this in that spirit of cooperation with the Chancellor of the Duchy. I look forward to working with him in the national interest to building that resilience for the future.
Thank you, Mr. Speaker, and I'd like to thank the Honourable Member for Melton and Syston for his response and for the tone in which he spoke. He did set out what the previous government has done, and in my statement I acknowledge that progress has been made, but I think it's also right that a new government takes the opportunity to have a fresh look at this with fresh eyes and to do that in the right spirit. He asked a couple of questions on consultation with the devolved administrations. Yes, that's essential. Also within England, with local authorities and with elected mayors too. It's really important that different parts of the country work together when there's a national emergency. There are also questions about how this operates within government and on the balance of responsibility between the centre and individual government departments. And Baroness Hallett is quite clear that in a truly national emergency, the centre has to step up and it can't be left just to individual government departments. He is right to conclude in the way that he did about the spirit of cooperation that we need on this. This is in the national interest, it's in the public's interest. It is the first duty of any government, of any political stripe, to do what it can to protect the public. And the challenge that we face is that the risks we face are more complex and more unpredictable than they have been in the past. So as I said in my statement, you cannot fully plan for every risk, but you have to try to have a system in place which gives you the best possible chance of planning for the risks that you can see in front of you.
Florence Eshalomi.
Thank you, Mr. Speaker, and I thank the Minister, my right honourable friend, for his statement this morning. As with everyone, my thoughts are with the many victims who tragically lost their lives. And I want to use this opportunity, Mr. Speaker, to pay tribute to the hard-working staff at St Thomas's Hospital in my constituency who cared for so many people in those last dying days, including caring for the former Prime Minister when he caught Covid-19. Mr. Speaker, you'll be aware that the National COVID Memorial Wall is in my constituency, a stark reminder to the many lives that were lost, each heart painstakingly painted by a family member in dedication to their lost one. It's a reminder of the many lives that were lost. I'd like to use this opportunity to ask the Chancellor, will he visit the COVID Memorial Wall with me and meet with the families and look at how we can make that wall permanent? Because it's not just about the resilience, but remembering those victims who tragically lost their lives.
Mr. Speaker, I thank my honourable friend for her question. She's absolutely right to pay tribute to the staff at St Thomas's and the other NHS staff around the country who did so much to care for people during that very, very difficult period. I have visited the wall, the memorial wall in her constituency before. She's right, it's an incredibly moving and human experience, and I'm very happy to take her up on her invitation to do so again.
Lib Dem spokesperson Layla Moran.
Thank you, Mr. Speaker. I'm here covering for our spokesperson who sadly can't be here today. But I would like to start by paying tribute to Baroness Hallett and all those who have painfully give evidence to this inquiry. It will not have been easy for them, and our hearts go out to them. This will be a painful day. The inquiry's damning findings confirm in clear terms what we unfortunately already knew. And this must be a moment for change. The country was badly let down during the pandemic, and this new government must ensure that lessons are learned swiftly. The Liberal Democrats called for this inquiry back in 2020, and we will continue to demand that the full facts are known about every aspect of this catastrophic failure. One area of particular focus was on the lack of leadership provided by the then Conservative government. The inquiry found that proper scrutiny and accountability was often missed by ministers, And that's why backbenchers from across this House set up the all-party parliamentary group on coronavirus, which I was privileged to chair. Over 18 months, we heard from frontline workers, public health professionals, bereaved families, and there was a deep frustration that they could see what was going wrong and it was falling on deaf ears in Whitehall. So this is a moment to change how politics works, and I hope that the Minister and the Government will work across the aisle. So what will the Government do to ensure the right voices are in the room for future such health emergencies? And do they agree that we need a Commissioner for ageing and older people, as the Liberal Democrats have been advocating for? Another area that was a critical failure was on care homes. Many of those did not die directly from COVID, but due to the lack of care. Does the Government agree that patients and care home residents should be given a new legal right to maintain contact in all health and care settings? The third area that has been underreported is on long COVID. Many of our frontline workers, many will remember in that November, standing in the cold, banging on our drums for them, and yet they haven't received compensation for a disability that has put them out of their beloved profession. Will the Cabinet Office work with the Department for Work and Pensions to progress the compensation scheme, which is already in train, and to gather the right evidence to make sure we get it right? And very finally, on the memorial, will he implement the recommendations from the COVID Commemoration Commission's final report?
Sorry. Can I just say from Brent, we're all learning, but it's by setting the best example. It's meant to be 2 minutes, not 3. So if you could please look to helping each other. Because in the end, I'll have members complain they didn't get in. Secretary McFadden.
Thank you, Mr Speaker, and I thank the Honourable Member for her questions and again the spirit in which she asked them. Look, the truth is, it's very easy for any of us to say lessons must be learned, and whenever anything goes wrong, people say that. And the proof is in the actual practice. Will it be shown in practice? And that is the ultimate test for all of this. I'm very happy to confirm with her that, just as I said to the opposition spokesperson, yes, we're happy to work across the aisle on this, to consider suggestions that are made and so on. And on the matter of the memorial, my colleagues at the Department for Culture, Media and Sport are considering the recommendations that have been made on that question.
Very good.
Thank you, Mr Speaker. The Minister is aware that Northwick Park Hospital in my constituency was the epicentre at the start of the pandemic. And he spoke of resilience. What that lack of resilience meant to those nurses in Northwick Park Hospital was that they had to wear bin bags to protect themselves. I noted in his speech that he spoke of Grenfell, and I think that was fundamentally important, that this is not simply resilience on health. And in that regard, I would ask him, would he look very particularly at reinforced aerated concrete, the rack problem that we have seen in our schools? That concrete was also used in many housing developments at the time, and I think we need to be resilient for any potential disasters there also.
Thank you, Mr Speaker. Again, I echo his tribute to the work of the NHS staff in his constituency. And on the matter of RAC in public buildings, this is part of the inheritance that we have. Just because this has slipped down the news agenda somewhat does not mean that the problem has gone away. And we are going to have to, in time, address this to make sure that the buildings, whether it's housing accommodation or public buildings, are safe for people to live in and to work in and to be treated in.
Right word.
Thank you, Mr Speaker. And I congratulate the Chancellor of the Duchy of Lancaster on his new role and welcome the tone of his statement. This report is a stark reminder, if any was needed, that even the most eminent and public-spirited of scientists can occasionally be wrong when groupthink affects assumptions. What can the government do to ensure that both ministers and parliamentarians have access to the widest possible range of advice, including, where appropriate, dissenting voices across a whole range of issues?
Mr Speaker, I thank him for his question, and he's right that groupthink is one of the things identified in the report. So it is important for government to have access to the widest range of advice. But no part of that on my part or the government's part will be engaging in anti-science rhetoric or anything of that nature. A diversity of views, yes. A denial of the facts, no.
Anna Dixon.
Thank you, Speaker, and thank you, Right Honourable Member, for his statement. Yesterday evening I walked alongside the COVID memorial wall and was moved by the number of hearts, each one representing someone who has died from COVID. And I wish to extend my sympathies to all those bereaved families who lost loved ones. Many people of all ages continue to suffer the consequences of that lack of resilience and preparedness due to long COVID. So will the Chancellor of the Duchy reassure members of the House that those children and adults who continue to suffer with long COVID, like the young granddaughter of one of my constituents in Shipley, will not be forgotten as the inquiry continues its work? Thank you.
I thank the Honourable Member for Shipley for her question. Again, I echo her comments on the memorial wall. We've got a lot of new members in the House following the election, Mr Speaker, and my recommendation to any of them, if they find themselves with a spare hour, is you could do a lot worse than go there, contemplate, and just look at the outpouring of grief that is reflected in that wall. She's absolutely right on long COVID. I mentioned it in my opening remarks. When we're thinking about this pandemic, yes, of course we think about those who were lost and their families, but there are also people several years on from the pandemic still living with those consequences.
Robin Swan.
Thank you very much, Mr Speaker, and Chancellor, can I thank you for your statement. As the former Minister of Health in Northern Ireland who served during the pandemic, my thoughts and condolences are with those who lost and who were bereaved, and also attribute of thanks to those who worked across health and social care during that trying time. The Minister said that resilience has to be for all of us, not just for some. Can I ask him to ensure that all the devolved nations are equally involved? He talked about it being a consultation with the devolved nations and regions. Can I ask him for it to be more than a consultation, but actually a partnership?
Mr Speaker, I thank the Honourable Member for his comments, and he's quite right. This report covers all parts of the United Kingdom. It makes a real effort to do so. The new Prime Minister also made an effort to do so in the days following the election, and one of his first priorities was to visit Northern Ireland, and I agree with him about cooperation. I think it's essential, rather than making sometimes small differences act to the detriment of the whole effort.
Sean Davies.
Thank you, Mr Speaker. I welcome my right honourable friend to his place and my near neighbour. Like so many families, my family was also affected by the death of a loved one during the pandemic, and a small heart on the National Memorial Wall reflects her, my auntie, for time immemorial. Will my right honourable friend agree with me that procurement during a state of emergency such as the pandemic is important, and any fraud to the public purse must be pursued ruthlessly?
Hear, hear.
Mr Speaker, I thank the Honourable Member for Telford for his questions, and please accept my condolences for the loss of his auntie during the pandemic. He's absolutely right to draw our attention to the procurement issues which were highlighted. They're not specifically covered in this report, but they will be, and he'll be aware that this government will bring forward proposals for a COVID fraud commissioner to try to recover as much as we can of money that was lost to fraud during that period or to waste.
Helen Morgan.
Thank you very much, Mr Speaker. I welcome the statement from the Chancellor of the Duchy of Lancaster, and I was particularly pleased to hear him talk about the role of local government. Local government was instrumental in the response, and I would imagine the inquiry will find that had it had a greater role, resilience would have been better. But local government financing is in crisis, as we know. My own local council is trying to save £100 million this year. What reassurance can he give us that local councils will be given the funding they need to have the resilience that we need in place for the future?
Yeah. I thank the honourable member for her question. She's right to both praise the role of local government. My own experience in Wolverhampton was that the council really stepped up and did a fantastic job for local citizens during the pandemic. The financial position of local government is difficult. The financial position on a number of things is difficult. And I'm afraid the truth is I can't stand here and promise to write big cheques for everything. We didn't say we'd do that during the election, and we will have to operate with the difficult, very difficult economic inheritance that we have. And everything that we do has to be underpinned by economic stability and financial responsibility. And tough as that is, the consequences of doing otherwise, I'm afraid we've seen all too clearly in recent years.
Lambos or Lambos?
Thank you, Mr. Speaker. In her report, Baroness Hallett said that the government's pandemic strategy from 2011 was outdated and lacked adaptability and was virtually abandoned on its first encounter with the pandemic. So can my right honourable friend give me an assurance that any future strategy will be robust and regularly updated?
I thank the honourable member for his question. Yes, one of the things that Baroness Hallett advises in her report is that every 3 years there's a proper exercise to test any plan and see if it's fit for purpose. That's an important recommendation for us to take away and consider. It is difficult in planning for every possible risk. This is not an easy thing to do, but it's really important to try to have the best possible systems in place between the centre of government, between the departments, and as we've said, between local authorities and devolved administrations too.
Andrew Sturton.
Thank you very much, Mr. Speaker. And can I thank the right honourable gentleman for the constructive way in which this has been approached, looking at both the things that went well and the things that we need to learn, and having that external scrutiny through the COVID inquiry provides that lens. And as the government now looks at the recommendations and starts to put the plans in place, some building on the work that was already being done, and some, as the right honourable gentleman said, is around things that need to improve. Could I suggest that external scrutiny around the government's response to that is equally as important? And will the right honourable gentleman ask Lord Norton's Statutory Inquiries Committee to monitor the government's response to the COVID inquiry?
I'm grateful to him for his question. I think scrutiny is always good, and I'm sure that what we do will be scrutinised. It's really important to have a proper dialogue with the public about these things too, because it does no harm for us as citizens as well as government ministers just having that conversation about resilience, about what we do in an emergency, how we think of it. We don't want to frighten anybody, but it's a good thing to do, and I think it's a proper role for government to have a good dialogue with the public about this.
Kat Ettles.
I visited the wall this week, and it was a stark reminder of my own experience during the pandemic. I'm an operating department practitioner, and I worked in emergency maternity theatres during that time. From day one, there was next to no strategy. Staff were fighting over inadequate PPE, and we tried to speak up, but we weren't heard. We were given out-of-date masks, we were given gowns that were ill-fitting, and visors that just fell off our faces. Even when colleagues sadly lost their lives to the disease, the chaos continued. I sat with new mothers holding their hands because their partners weren't allowed to be with them. We stood by the bedside of a colleague on life support as they lost their battle with COVID. And even now, staff are being traumatised all over again when people who've waited so long for treatment cannot be helped. Will this government ensure NHS staff can input on future pandemic planning, as it is we who know how best to protect our patients?
Yeah. Mr. Speaker, I'm very, very grateful to my honourable friend for reflecting her experience. There's nothing I can add to the power of her words in her question just now, and she's absolutely right to say that planning for future pandemics has to listen to the voice of the staff, who will be the people that the country will rely on if we face any kind of similar emergency in the future.
Munira Woods.
Thank you very much, Mr. Speaker. I'm sure members on all sides of the House will recognise that children and young people really felt the impact of this pandemic and the impact of the lockdowns on their mental health, on their learning, on their social and emotional development. And whilst we all recognise that in an emergency, executive decisions have to be taken to protect children and staff in schools, I think the public were aghast that pubs and zoos opened before our schools and colleges. So will his committee look at putting a proper process in place, potentially designating schools and colleges as national critical infrastructure, where this House will take a vote on any extended lockdowns, if that ever needs to be put in place, of our schools and colleges, and that evidence is taken from the Children's Commissioner and our school and college leaders?
Thank you, Mr. Speaker. The Honourable Lady is quite right to draw attention to the impact that the pandemic had on education, both in terms of lost learning and, as I said in my statement, in the great inequality that children suffered from differential access to online learning. Did they have a good Wi-Fi connection at home? Did they have the equipment? Was the school fully geared up to providing online learning? The answer for some children to some of those questions was yes, but the answer for a lot of children was no. And I think it's really important in future planning that if we have to make a change, we make sure it doesn't reinforce inequality, but helps everyone.
John Slinger.
Thank you, Mr. Speaker. I'd like to put on record my gratitude for the service of the staff of the Hospital of St Cross, the other healthcare workers and volunteers across my constituency of Rugby. Would the Chancellor agree with me that failures of state in the pandemic, in the case of the pandemic or in other cases, occur often due to underinvestment and an ideological suspicion of the state by some, including, regrettably, some members of the last government? Would the Chancellor agree with me that a party that puts service first and believes in investing in our health service and wider government will ensure that this country is far better ready for future crises?
I'm grateful to the Honourable Member for Rugby for his question. He talks about failures of state, and that is the essential finding in Baroness Hallett's report. There were failures of state. He also mentions ideology. I tried in my statement to make clear we would not take an ideological approach, that where good things had been done in response to the pandemic by the last government, we would keep them. But I also think a change of government after such a long period in power is an opportunity for fresh eyes. And not necessarily in a partisan way, just having a different set of people to look at what has been done, to keep what is good about what has been done, but also to change things if that needs to be the case. It is one of the advantages of having a change of government, regardless of the political colour, after one has been in office for so many years.
Pam Cox.
Mr. Speaker, and I thank my right honourable friend for his statement. I welcome his announcement of a review of national resilience. Will he agree with me that the many legacies of the pandemic are still very much with us, from the awful personal impacts of bereavement and long COVID to the terrible public service impacts on everything from school readiness, social care systems and more, and that those impacts were worse than they need have been, as set out by Baronet Hallett yesterday? In that spirit, will he agree with me that this government's work of renewal must necessarily also be a work of repair?
I thank the Honourable Member for Colchester for her question, and she talked about the legacies. Yes, they very much are still here. And in terms of vulnerabilities and exposure, Baroness Hallett was also, she also mentioned the different impacts on different ethnic minority communities. And when I say resilience has to be for everyone, that's also what I'm talking about. It has to be for everyone, young and old, and regardless of their ethnic background. And sometimes there were vulnerabilities, particularly in the early months of the pandemic, which exposed inequalities in that regard that should give us all pause for thought.
Alex Burrows-Curtis.
May I thank my right honourable friend for his statement and welcome him to his place. May I also thank Baroness Hallett and her team and associate myself with the comments of everybody here to the victims and the bereaved families and those frontline workers. As the Chancellor, my right honourable friend, said, the voices of the bereaved are at the heart of this report, and that's quite right. Can he assure me that when the government is reflecting on the recommendations that that same spirit will be applied in order to give them the insight into the government's response?
I'm grateful to the honourable member for his question. Baroness Hallett deserves credit for putting the voices of the bereaved up front. If anyone's looked at the actual report, we will find that before we even get into the recommendations and the findings and so on, there are quotes from the bereaved which just bring home exactly what these losses of loved ones meant to people and the lasting impact of them. And here we are, some 4 years on from the beginning of this.
Jane Kirkham.
Speaker, I recognise the conclusion in Baroness Hallett's very clear report and thank her for it. In Cornwall, our peripherality made it so much harder. Our local authority public health test and trace was halted by government on the 12th of March when fewer than half a dozen cases were in existence in Cornwall. PPE came very slowly. Citizens were making masks and some councillors and officers actually drove up to Exeter to pick some up. Care homes and workers particularly were slow to get PPE, and in many care homes in my constituency there were tragic results. My question is that will we make sure that local authority public health directors can be more involved with decision making and setting up local solutions such as test and trace?
I'm grateful to the honourable member for Truro and Falmouth for her question. She is quite right to highlight the issue of care homes where it was such a difficult situation throughout the pandemic. Where trying to get the right PPE to the staff was a huge problem during the early weeks of the pandemic. I remember raising questions about that, and that just exposed what a scramble for safety there was, particularly in the early months. So she's quite right to urge us to learn the lessons from that.
Ben Cole.
Thank you. I thank my right honourable friend for his statement. And, Mr. Speaker, as you will notice, the report and other people have referred to the fact that there was a failure to engage appropriately with local government in preparing for the pandemic. And sadly, this failure continued throughout the pandemic. And I had the dubious pleasure of being the Cabinet Member for Health and Social Care in Hammersmith and Fulham Council throughout the pandemic. And we had to fight to close our care homes because the hospitals, under instructions from the government, were discharging residents without testing and wouldn't listen to us and wouldn't stop. We had to fight to get vaccination in our local pharmacies. And we had to fight to establish a local test and trace system, which then reached 99% of people when the government was only reaching 62% of people. So does my right honourable friend agree that further stages of the inquiry, or indeed what the government now does, should identify and learn from the government's failure not only to engage appropriately with local authorities before the pandemic, but during the pandemic as well?
I'm grateful to the honourable member for Chelsea and Fulham, and I think the points he makes about local government are very, very well made. My own experience in my own local authority area, as I said, was that I thought the local council really stepped up. And sometimes this issue of who is vulnerable and where are they is much easier for a local authority to know that than for central government. So I think the spirit of cooperation that I've called for in my opening statement is really important here. It's in the public interest, it's in the national interest, and that's what we've got to do, because if we cooperate, we will be stronger.
Chris Vins.
Thank you, and I thank my right honourable friend for an important statement and welcome him to his new role. Like many of us in this room, I lost a good friend during the pandemic, and Harlow lost an incredible councillor in Councillor Frances Mason, incredible community champion who served her community until the very end. In my constituency of Harlow, NHS staff of Princess Alexandra Hospital were on the front line during this terrible period. Their feedback to me was that the government's initial response to COVID was too slow and failed to recognise the seriousness of the issue. Would the Chancellor agree with them?
I thank the honourable member for Harlow for his question, and please accept my condolences on the loss of his colleague Frances Mason. He's right to pay tribute to the NHS staff. I think there were a number of failings. Baroness Hallett has set them out, whether it's speed, leadership, coordination. It's important that we try to learn lessons from this, and that's what we intend to do.
Joanna Baxter.
Thank you, Mr Speaker, and thank you to my right honourable friend for his statement. Can I associate myself with the comments made today about the bereaved and the integral role of our public sector workers throughout the pandemic? Local government workers across Paisley and Renfrewshire South were on the front line during the period of the pandemic. They were the workers who established temporary mortuaries to bury our dead. They were the ones looking after the children of key workers so that they could ensure they went to work. Can I ask my right honourable friend if he could say a little more about how we ensure local authorities will be treated as an integral partner to our resilience planning and the response going forward? That's not just about their funding, but also about the respect with which they are treated by government. And can he assure us that going forward, in that spirit of cooperation across the four nations, that consequentials which are given to the Scottish Government are passed on to their intended recipients? Thank you.
Thank you, Mr Speaker, and I'm grateful to the honourable member for Paisley and Renfrewshire South for her question. She's absolutely right, as other honourable members have today, to draw attention to the important role that local authorities play. And I hope I made it clear in my opening statement and in the responses I've given to the questions today that this has to be an effort for the whole of the United Kingdom. Central government, devolved governments and local authorities in every part of the country. We are stronger together.
Perry Moon.
Thank you, Mr Speaker. I'd like to thank my honourable friend for his statement, and also Baroness Hallett for her important report. On the doorsteps of Camberwell, Redruth and Hale, the anger and grief is still palpable. Where was the accountability from ministers? Where was the leadership? Royal Cornwall Hospital Trust was on high alert before the pandemic hit. Isn't it the case, Mr Speaker, that our NHS was desperately struggling years before through mismanagement from the party opposite, and that lives were unnecessarily lost because of it, and that careful preparedness planning and management of our NHS and social care services must be a top priority for this government?
Can I thank the honourable member for Camberwell and Redruth for his question. He's absolutely right to say that the NHS was in a vulnerable position before the pandemic, as it went into the pandemic, and that's why we think the long-term health of the NHS is so important. And my right honourable friend, the Secretary of State for Health and Social Care, has begun that process. I have to be honest with the House. This is not something that's going to happen overnight, but it should still be an important aim for us to have better long-term strength for the NHS.
Thank you, Mr. Speaker. Firstly, can I welcome my right honourable friend to his place on the front bench and thank him for his statement. In it, he touched on victims to what has been labelled the shadow pandemic of a surge in domestic violence during lockdown. Does he agree with me that any lessons learned have to include action to protect those for whom the instruction stay at home is the most dangerous instruction they can receive?
I thank the Honourable Member for Banbury for his question, and he highlights a very important issue which I also spoke about in my opening remarks. It is an important aim of this government to reduce violence against women and girls, and I can assure him that the Minister who's put in charge of this will champion it as a cause with a passion and a determination that I think and I really hope we'll see results in this endeavour, because home should be a place of safety. And sadly, as he rightly points out, during the pandemic, that was not the case for some.
Adam Thompson.
Thank you, Mr. Speaker, and thank you to my right honourable friend for his statement today. We all have stories from the pandemic about how our families and about how we were affected by the pandemic, and that is true for members in this House and constituents right across the country. For me, that meant my family on the other side of the England-Wales border and my stepdad, who was diagnosed with multiple sclerosis during the pandemic. It meant that I wasn't able to visit my stepfather and I wasn't able to provide the support to my mother that our family needed as we went through the pandemic. Will the right honourable member ensure me that we will be creating a joined-up national strategy? As he rightly notes, the pandemic did not pay attention to our national borders. Will he assure me that we will be working with scientists very closely to ensure a national strategy moving forward?
I thank the Honourable Member for Erewash. Yes, of course, he highlights the difficulties people had not being able to visit relatives and so on. This question of being joined up across different parts of the UK is really important. This kind of planning is no place for, as I said, sometimes small differences to get in the way. We've got to work together, we've got to work in a cooperative way, and we are stronger together.
Joe Powell.
Speaker, Module 1 of this report has found that pre-existing inequalities in health were not taken into account in the pandemic planning. And in my constituency in Kensington-Bayswater, they are particularly wide, as we also saw at Grenfell Tower. So I welcome the Minister's statement that the Grenfell inquiry recommendations will be incorporated into the government's response. And does the Minister agree with me that in that response we must have a far better plan for protecting the most vulnerable in our society, who are often most disproportionately affected?
I'm grateful to the Honourable Member for Kensington and for his mention of the Grenfell inquiry. As I said in my opening remarks, it's important to take the findings from that into account. And it's also true that pre-existing inequalities left people more vulnerable. What a national emergency like this does is exposes the weak points and it brings them into a glaring public light, and it weakens the response of the whole country. So in terms of inequalities, be they on the basis of ethnic minority, be they on the basis of income, the truth is we have a stronger response as a country if we manage to reduce those.
Thank you, Mr. Speaker, and thank you to my right honourable friend for his statement. To build on the previous question, the Covid-19 Bereaved Families Group have said that Module 1 of the report doesn't go far enough in looking at inequality. Given the high incidence of diabetes and other long-term health conditions in the South Asian community in particular, in my constituency of Ealing Southall, and the disproportionate COVID death rate in disabled Black and Asian people, could he outline what assessment he has made of the deep structural inequalities in the health of the nation after years of Conservative inaction that caused us to be less prepared for COVID-19 and ultimately led to unnecessary deaths.
I'm grateful to the Honourable Member for Ealing Southall for her question, and she's quite right to point out the particular health conditions that can be higher in one part of the community. And as I've said a few times today, the inequalities that were exposed in the pandemic made the response weaker than it might have been. And if we're going to be stronger and better able to handle an emergency like this in the future, then we have to address those inequalities. That is not just in the interest of those who will directly help, but it's in the interest of all of us, because when it comes to an emergency like this, we are all in it together.
Right, that completes the first statement. I'll let the front benches change over.